So for the next thing that could actually help us confirm pregnancy, we'll look at what is known as secondary amenorrhea. So secondary amenorrhea as a sign of pregnancy. Sorry, there's a typo there. So let's quickly define terminologies before we go on in, and the lecture is very simple. What is amenorrhea? Somebody has stopped menstruating. Now it is secondary because this person, initially the person was menstruating, but later on the person stopped menstruating. You get the whole thing. So of course, pregnancy could be a cause of what? Somebody to stop menstruating. Do you understand? So if somebody that was earlier on menstruating stops menstruating, it gives us an idea that, is a pregnancy that stops the menstruation. So what we have, just trying to establish the link between how pregnancy can be able to stop menstruation in a woman that was menstruating. So just so you know, it's one of the most commonest early signs of pregnancy. So most women, they only confirm that they are pregnant only when they miss out on their period. So it refers to the absence of menstrual periods for about 3 months. Okay, so it's someone who was regularly having regular cycles. Do you understand? So 6 months, right? They push it to 6 months if the person was not having regular cycles. Do you get the difference? So what is the link up between pregnancy and stopping menstruation? It's simply because the human chorionic gonadotropin and progesterone hormones, their levels are usually, up the hill in pregnancy. So the endometrial lining is maintained to support the developing embryo, so it doesn't shed as it would during a normal period. Is the endometrius shedding out, that's when a woman bleeds. So therefore, missing a period is often the first clue. It gives you an idea, okay, that the person is pregnant. So other causes to consider, there are other things that could make someone miss period. So that's to tell you that somebody missing a period doesn't always signify pregnancy. So other things that could make somebody miss periods include polycystic ovarian syndrome, thyroid disorders, hyperprolactinemia, stress or significant weight management and changes rather. So sometimes it's because of some side effects or some medications that the person is taking. Do you understand? So this is not something that you can single-handedly say somebody is pregnant. You have to still do other further things, all right? And that's why they kept the long 3 months. They also kept the long 6 months, okay? Because over time you can confirm it better, right? So just so you know that this is actually a thing we look out for in pregnant women.